afternoon and welcome to Real Talk with Sean, everybody. This afternoon, I have the pleasure of speaking with Miss April, and we're going to be discussing some illnesses that she currently has. One, which is hydradenitis. She also suffers from
Yes,
fibromyalgia and panic disorder. I want to thank you for joining me this afternoon, April. I really appreciate you accepting my invite.
absolutely.
Before I ask my first question, I want to let you know that from me looking at your page, I feel that you're one strong Black woman. And you actually said it on your page, which is one of the reasons I feel that you're strong. Not only do you share your story and a piece of your life with us and some of what you're going through, you also smile through it all. And I think that's
I
very
try.
important. I think it's important because if we give up here, then our body is going to react to that. And from what I'm seeing, you haven't given
Right.
up mentally. And I love it. My first question to you is what, because I've never heard of this. What is hydradenitis?
Okay. With hydradenitis, a lot of people, when when people who have it, they refer to what they have. They'll say, "Oh, I've got HS." Naturally, people in their mind, the just H in general, it gives a red flag to people, and they're like, what you said? H what? HIV or but it kind of it sent a red flag to a lot of
Right.
people. And so hydradenitis, they the short terminology for people when they're talking, they'll say, "Oh yeah, I have HS." Hydradenitis suppurativa. I still mispronounce the second word sometimes. It's basically, I know a lot of people hear about people when they have like a boil
Mm-hmm.
or an abscess.
Yes.
Um, with hydradenitis, it's three stages. They have like Hurley stage 1, stage 2, and stage 3. Right now, I'm in stage 2. I have my baby, my first baby coming here.
Okay.
I have friends that have hydradenitis as well, but it's a long-term condition. It's not something that I can ever get rid of. I can just try to maintain it. And which would mean I might say I have to use certain soaps. I have to have a certain skin care routine. Um, it's not a contagious disease. It's something that it's within you. Some people who have reoccurring abscesses or recurring boils, that they'll call it, they really have hydradenitis if they have them reoccurring and in the same spot. Um, a boil or abscess, normally people get them under their arms.
Right.
They'll say, "Oh yeah, I shaved and I had a hair bump," but with a person with hydradenitis, the difference is it's like your my description of it is almost like your inner layer has an allergy to things that come to the outer layer of the skin. If soon as any pore is clogged up, or you know, people with hydradenitis have to bathe a certain amount. Like I'll take a shower twice a day. Sometimes it'll be 3 times a day, because if I sweat and I feel okay, like it's a layer of sweat that's there, and I have to get it clean because I have to stay dry.
Okay.
The sweating will induce like the pores getting clogged. The thing is, a person can look at you and say, "There's nothing wrong with you. You look perfectly
Yeah.
fine."
Yeah. Yeah.
Everybody is not affected from the neck up with hydradenitis.
Okay.
Some people have it in their scalp. Some people will have it on their face. I know that I'll have certain spots that'll come up on my face. Like I've got one small one that came up right here, and normal people will say, "Oh, it's just a pimple." With me, hydradenitis flare because I don't usually have any spots come up on my face.
Right.
It normally acts under the breast, under the arms, the groin area, the inner thigh, the buttocks area, any area that is normally covered and can produce sweat. It'll be like a flare zone, as I call it. If I'm having, like right now, I have active flare. And that's another thing where a lot of people say, oh, a flare up. What do you mean? What kind of flare up are you having? Then you gotta break down the whole, okay, like I had hydradenitis. I mean, I got a painful spot that's come up, and no, it's not contagious. You can't get it. But that's the main thing when it comes to hydradenitis. You, like, I am currently on disability for hydradenitis. And I think I got diagnosed with hydradenitis about 3 years ago.
How long?
And about 3 years ago, maybe 4 years ago, I got an actual diagnosis. And the first time I ever had a spot come up, I was probably about 18. And with me being 18 years old, and it was just, the spot that it came up was pilonidal. Pilonidal means it's like right there by your tailbone.
Okay.
So that was the first spot that I had on my butt. And I was 18. I had just graduated high school, working at the grocery store, and I just so happened to back up against the little piece where you stand behind the register, and I felt something pinch, and I was just like, I don't feel right. Something like hurting right there. And so my mom is a registered nurse, and my mom, she was just like, oh, you got a boy. That's all it is. So I went on to have pop up, and I'm like, it's no way. I'm just, what can I do to stop it? And over time, I had surgery, pilonidal cyst twice. I've had that removed twice. Pilonidal on the tailbone, like the tailbone region.
So y'all, excuse the choppiness. You already know audio issues happen, but we're here.
It happens. We're here.
Yeah. Go back to me for when you said you noticed that the bump on your tail when you were working at the grocery store. Start back from right there.
Okay, so I was like 18 then, and I noticed that I had this spot that had come up. Just so happened to, I told my mom about it, and she brushed it off as, okay, you got a boil. That's all it is. I was like, okay. I did not like it, but at the same time, it was just one of them things. I guess I got to deal with that. So got over that hump, and the first experience dealing with it, I think that was like one of the worst experiences, because at least at the time I thought it was the worst, because being that it was the first one and I never had one. So a lot of people will say that if you have a boil, that they smell really bad when they open up and they drain.
Yeah.
And I was not prepared at all. Like, I spent a week laying on the couch at home, because I stayed, still at the time I was staying with my mom and dad. And I spent about a week laying around on the couch. Like, I couldn't lay on my back. I was just like on one side. And I told my mom, I was like, Mom, I can barely get up. It hurts so bad. And I went in there, and I know my mom know what my butt looked like, like the back of her own hand, because I'm always showing it to her, like, Mom, look at this. Look at this.
Right.
But it's like that particular day, I went in there and I was like, Mom, I can barely move. Like, it hurts so bad. And I needed leaning over and to show her. And she said, it just opened up and it started to drain. And mom, it was so pitiful. I felt so embarrassed though, because she literally, like, she, at the time, newspapers and stuff always came. She literally laid newspaper on the kitchen floor, and I sat there on the kitchen floor on newspaper. And because it was draining
Right.
so much, she got, gloves, and she was pressing it to try to drain it. And that was the first experience I had with one. And after that, I pretty much just prayed all the time. I was like, please do not ever let that come back, Lord. Please don't let me have to go through that again. But it just so happened that with HS, that wound up being my normal. I didn't have another one that bad for a couple of years. I want to say about 6 or 7 years went by. I didn't have any more issues with it. And then I was about 24, 25, and I started having more reoccurring issues with it. And it was, my first pop-up zones were underneath my breast. And the spots would start out very small. Then they would start to get red, they will get swollen, and then sometimes they'll drain, sometimes they won't. Sometimes they just flare up and they'll go back down. So it's like I have scarring from over the years from the different spots that I've had.
Right.
And then a way to describe a person with hydradenitis skin is, I don't know if you ever remember like kids having what they call ant farms, and they have the ants in it, and they go down and they make like little tunnels,
Yeah.
and you can see like little skinny tunnels.
Mm-hmm.
Pretty much hydradenitis does that. You'll have tunneling under your skin.
Okay.
So you may have a spot here, and if you squeeze it to drain it, or if it's in any way pushed in, then it's gonna tunnel down and it's gonna come up on a spot close to it. Or it may tunnel down and come up on a different area. It's just constant tunneling under those spots.
Of course, I'm assuming it's painful too to go through that, because I know from what I hear, boils hurt, and if that's what
Yes,
you related to, so
yeah. Um, the pain that you'll 9 times out of 10, most of your pain will be during movement, when you're trying to get up out of a chair and then trying to sit down in a chair, or in worst case scenarios, like when I was working and had been diagnosed, I would be at work, and because I would move boxes because I worked in a deli, it's like pulling a box up and trying to
up
carry
again.
it
Are you
against
breaking
your
up again?
chest.
I'm going to back up a little bit. I heard you mention from in the beginning when you said it was there are 3 stages to HS, right?
Yeah.
And you're stage 2. What will you eventually, hopefully not, of course, but the way that the disease itself works, will you eventually be a stage 3?
Well, see, some people, a lot of the time, like, do research on it, and like how I've asked my doctors, I have been stage 2 for about, the way he's looking at it, from what he saw when he first checked me and looked at my skin, he said, you're about in stage 2. And since I've been diagnosed, I've remained in stage 2.
What is the difference between stage 3? Like, do you know the difference? Like, what is stage 3
Yeah,
worse than stage 2?
definitely.
Wow.
I have 2 friends that are, fairly close to me. Um, one female and one male. So it females and males are affected by it. And also it's like, with them being stage 3, they have areas that they have had like chunks removed. Like when you have the surgery, you they have different ways that they'll go about the surgery for hydradenitis. Sometimes they will do what we call cherry picking. And if they cherry pick, they just go to small areas, they clear them out, and then they pack them with like like sanitized and sterile strips. They'll pack them. So it's like you with my surgery for the pilonidal cyst that I had on my bottom, they went in, they made incisions right at the top of my tailbone, like at the split. And they afterwards, they took the steri strips and they stuffed it. And I had to let it heal from the inside out. And with my friends that are in stage 3, like they have had like whole areas of skin removed or like a large area cut out, and they've had to let like open wounds
Oh,
that are about that wide
right.
heal from the out, from the inside out.
Wow.
So thus far I've been blessed that I haven't had to have any extensive surgeries for that.
We're gonna keep it that way. It's gonna
I'm
stay that way for you.
yes,
Right.
pray
That's right.
pray that it stay that way. But
Exactly.
it's like over time, that's one of those constant worries. And with hydradenitis, fibromyalgia, and panic disorder are all actually linked.
Okay.
It's
I was gonna be
it's
a question of mine. Okay.
yes, it's like they're linked. Um, Hydradenitis already in itself, you're constantly in your mind, you're thinking, okay, I felt, like a spot, and it's like, oh my gosh, now I'm about to deal with another one of these spots. Painful. And it's more so painful, like I said, when you're moving,
Right.
uh, sitting, like you can have what people call a sitting disability, where you're disabled once you're sitting. You can have a disability standing disability. With hydradenitis, you literally don't know when it's going to be bad. You can have you can have maybe 2 good days, 3 good days out of a week, and then you may have the rest of the week that you're miserable because you've got a flared up spot and you got to treat that accordingly.
Right.
Like I can't use certain soaps. I Even though Bath and Body Works, oh, it smells so good.
Right. Right.
I can't use Bath and Body Works, not only because of as a female you don't use perfume soaps in certain areas, but I can't use perfume soaps under my breasts. I can't use it on my inner thighs because those are areas where I have hydradenitis flares. I can't use it anywhere in my groin, even if it's not on my actual genital
Right.
area. I can't use it. I use antibacterial Dove, and I use it's called clindamycin topical gel. It's an antibiotic gel that it's not an oral antibiotic, but it's a topical antibiotic.
Right.
So, and I use what they call antimicrobial skin cleanser.
Hmm.
Like I buy this specific stuff when I go to the pharmacy that's just for cleaning my skin. It's basically surgical cleanser.
Okay.
When people go in for surgeries, they normally give you that bottle and say, oh, we need you to bathe with
Yep.
this
Okay.
to have you sanitize. And it's basically like I have to sanitize my skin every time I take a shower.
Wow. Do they come anywhere else, or it's kind of
It's
landed right there?
mine are basically in what they call, well, what I call hot spots.
Okay. Okay. That's a
I
good
call
one.
them hot spots
Right.
because I say, like, I have yet to have any down my arms, on my back, or below my thigh area.
Okay.
It's always, my spots have always been under the breasts, under the arms, in the creases of my groin area, and like my inner thighs. I've even had them like in the hairline.
Right.
And like I I try to stay away from shaving as much as possible.
Right.
And what I do is I'll get like I have a set of mini trimmers that are specifically for, trimming up my arms. The only place I can only shave my calf area,
Okay.
and everything else is like maintenance that way with the trimmers. Because if you, with hydradenitis, if you shave, you are doubling the chance of a spot coming back.
Okay.
You're
That makes
basically
sense.
setting yourself up for one to come up. And I just like to avoid it. I'm just like, okay, I'll just trim it. It's gonna be low, but it ain't bald. It ain't gone away. I just,
It's
you know,
low enough.
I,
Okay.
it's low enough.
Yeah.
I'm not gonna be Jungle Jane, but
Right.
like,
Right.
you know,
I
but
got you.
that's like the main thing. The hydradenitis, you can have some good days and you can have some miserable days. I mean, I think that on after I had that first abscess, I remember also I wound up having to go to a doctor's appointment. And I mean, medical staff can be kind of rude.
Yeah, they can.
Medical staff can definitely be rude when it comes to certain things, because I have been to the emergency room when I had a spot that came up, and the doctor that saw me, he basically stuck me, numbed me. Now, this is that same pilonidal spot. I've had it 3 times, 2 surgeries on it. The first time I had it was when I was working at the grocery store. The second time, I went to the emergency room, and I think it was I can't even remember that doctor's name, but to this day, if I saw his face, I would know him.
Right.
But he literally just numbed me, took a scalpel, and made a dig at me, and just pressed it and slapped the bandage on it and sent me home.
Wow.
So
Yeah. Yeah. That really
late,
bothers me. Yeah. How
yeah, but
they downplay. You know,
yeah,
unless you're experiencing it yourself, people assume when people that have, as you stated, illnesses that you can't see per se, they
right.
assume that the person is overreacting. Don't look like you're in pain, so this can't be what I feel it is, but you're not the one
But when you
experiencing it.
see a lot of people that have chronic pain issues like that, we normalize it.
Yep.
We feel it, we know that it's happening, and we just kind of grin and bear it.
Yeah.
And
Yeah.
a lot of the time, like, nobody would know when I go out of this house today and I go step out and go do whatever I have to do today. Nobody's going to look at me and say, oh, that pitiful dear.
Right.
They're just going to be looking at me like regular, regular old April walking around,
Exactly.
it's no, it ain't no thought. It's not a second thought. You look
Yeah.
at a person, if they physically look okay, you're like, oh, there's nothing wrong with them.
So true.
But definitely that when I went to that doctor and the way I was treated, I was kind of like, wow. And I mean, naturally, the first time my mom took me to the doctor after. She took me to the doctor so that they could examine and make sure that it was all out. That
Right.
when I was at
Right.
the grocery store.
Hmm.
Um, that was awkward too, because I was 18. This is the first time a doctor got to look back, and you looking back there, and I'm up here, and I'm just
Right.
like,
Right.
I'm glad my mama in here with me.
Exactly.
But I mean, I got through that, and after the initial having to deal with that, the other times it's like now when I go to see my specialist, I jump up there and I'm snatching clothes off like,
Okay.
yeah, look right here,
Let's get to
you
it.
know. Let's get to it. Check me out. Tell me what's going on back there. You can, how.
I get it. I
But
completely
when the first time I had a surgery where they like it was the first time I ever got put to sleep actually. And that was another thing that had me pretty nervous about it was I was like, so y'all gotta put me to sleep to work on this? Because when I went to the emergency room for the one that had popped up and the doctor just kind of manhandled me in there,
that
I
happened.
wound up finding another doctor, and Dr. Robinson, love him. Dr. Robinson, I went into his office, and this is after I had went to that emergency room, and Dr. Robinson took one look at what was going on, and he said, I need for you to go over to the hospital so they can get you prepped for surgery. I was
Wow.
like, what? What? You gonna be, you got to put me to sleep? I was nervous then. Like, he said, yeah, he said, we're going to have to get this taken care of immediately. This is emergency situation.
Right.
So I went in, and next thing I know, they was wheeling me to the back. I was gone. They taking me on to the back, and that was the first time that I had one that was an emergency procedure.
Right.
The second time, it wasn't an emergency procedure, but um, that was Moreno. Dr. Moreno, he wound up like he was looking at what was going on, and he said, we're going to have to go back in because it's more under there that we're going to have to take care of. So I wound up eventually going back because at once the first doctor that did surgery on it, it was just like some tissue that was still damaged under there that he felt like needed to go.
Yeah.
So thankfully, I never wound up getting any chunks removed. It was
Yeah.
always just like a spot, and they would pack it. So, but the removing the packing that would be in there is something that, I mean, you know how they say, get in my shoes for one day, walk in my shoes for one
Right.
day.
Right.
Some people wouldn't survive in these shoes. Some
Right.
people would lose it in these shoes. They'd be like, nope, they too tight. Don't want them.
I already know
Take
they
them,
would. I already know.
take, take them away. But yeah, it's like, and it's so many different things that hydradenitis affects. It
Right.
affects a lot of your vitamin intake. Like I have, I have had like tooth loss,
Okay.
vitamin D deficiency, and yeah, I mean, I still like I said, I'm planning on like I'm over teeth at this point because
Yeah.
I was like, I'm just gonna have to go on ahead. I don't care nothing about this. You can snatch all these teeth out.
Okay.
I don't care. You can have them for real. You
Right.
can have these teeth. I mean, I'll just be a gummy bear. I don't care. But you know,
That's the last of my worries is my teeth
the
right.
least amount of worries. I
Right.
mean,
I get it.
but hydradenitis, like it affects your potassium.
Tell me what is fibromyalgia?
Okay, fibromyalgia is like the best way for me to describe it is your brain can get in a fog sometimes. Like I said, that's linked to that hydradenitis. It
Okay.
links in. Fibromyalgia, they tried to say for a long time that fibromyalgia was not a real disorder.
Ooh.
That's been like a debatable subject. And too many people came forward with those same, things that were like the word for it, the same symptoms.
Okay.
Um, with fibromyalgia, the best way, like I said, for me to describe it, hugging can be painful. Whereas, like with my arms or even with my legs, you know how a person can come up and they can just poke you in the arm.
Yeah.
And it really don't even really bother you. It could just be annoying.
Right.
With me over time, like the poke that I just did on my arm, I can still feel it. It
Wow.
burns. And that's just me doing it myself. So I like my son, he's 16, and he'll run up sometimes and he'll be standing there when I'm sitting at the table, and he'll just kind of take his hand and he'll like poking me
Uh-huh.
and poking me, but he's not thinking about the fact that, and I'll tell him, I'll be like, I've told you not to do that. And
Right.
he'll be like, what? What are you talking about? And I'm like, it hurts. Like it hurts. It burns after. It's like your receptors are, it's almost like you're wired wrong.
Okay.
Some people's nervous system is wired a certain way. And with fibromyalgia, they'll say that it can be linked to nerves being pressed on a certain way.
Okay.
And if you think about hydradenitis and how the tissue under your skin swells at certain places,
Right.
it will press nerves in a certain way that it will constantly have you in pain. Fibromyalgia also, they say past trauma. Past trauma can also add to fibromyalgia. And fibromyalgia, they'll say you can get into what's called a fibro fog. And a fibro fog is kind of like you're present in what you're doing, but you kind of you get confused. Sometimes you'll get to where you just like, I don't know what is going on right now. And see, perfect example of my fibro fog was when I did my TikTok video where I was talking about you can look at a person can, be smiling and everything is okay, but in their mind, like you can be totally like clueless. Like I had one of those confused days where nothing made sense. And
Wow.
it's kind of, it'll have you in just a deep fog. And it's not that like a person doesn't have to be every time they say, I just don't know. It doesn't instantly mean depression. Like a person doesn't have to be depressed to just be confused.
Yeah.
And
Yeah.
it totally happens a lot. But I found out about the fibromyalgia about a year after the hydradenitis.
Mhm.
And I have gone to like have testings done. Like I had something called not a EKG, which is for the heart,
Right.
but EMG, which they were taking these like needles basically, and they were sticking them into certain areas on my body,
Mhm.
and they were sending electroshocks to those areas to see how fast my receptors were going off. And that's another way that they were kind of like, yeah, we can definitely see that it's something on the right side of your body that is off. And they said we slightly see the delayed reaction, or well, not delayed reaction, but a hyper reaction as soon as they would send the electrical shock.
Wow.
um and I wound up and that I got that test done like the day after, no, the day of my birthday. And so that was like, oh yeah, I let them go torture me for my
Yeah.
birthday.
Yeah.
This year for my birthday was no better. Like the day after my birthday, I had a grease fire. So I wound up burning my foot. It's all in my TikTok
Yeah, I
videos when
know
I had,
I saw that on your TikTok where you were burned. Yeah.
woo. So for me to go from, and see, with me, I already have issues with my joints as far as I have what they call tendonitis,
Mhm.
bursitis,
I know about those.
carpal tunnel.
Yeah.
I recently had carpal tunnel surgery. they went in and did that repair. They
Right.
did that right after I had the burn on my foot. So it's like it was pretty funny when I went in for surgery, because I was like hopping with a boot and walking around like a zombie for a couple of days, like, oh yeah, I'm
Right.
coming. Wait for me.
Right.
Yeah, it's like sometimes you just I got to the point where I was like, can it get any worse?
Yeah.
Like, can it get any worse? But
You know what you just did? You just did right now to me what you say on your page. And still I
yeah,
smile. And I have to go back to that because you just made light of it. Like it's like you can't do nothing but at this point make
I
light of
mean,
it because I
I
mean
got to. It's like they say, you got to laugh to keep from crying
yeah,
sometimes,
yeah.
because I just knew that, and it was so, oh, it was a lot when I got that burn on my foot, because my daughter was in her last year of high school. And this was like a couple of days before prom.
Okay.
And I wound up burning, like, my birthday is April 26th. Tauruses, all
Oh,
right. Taurus,
yeah, I'm joking. Y'all good people. Y'all good.
we good, we good. And I wound up burning my foot the day after my birthday. Like, I was trying to follow what my doctor was telling me. My doctor was saying you need to start to eat breakfast in the morning when you take your medicine, because I also have high blood pressure. I have
Oh, dang.
acid reflux.
Right.
Yeah, so it's like I don't, and a lot of people would probably think that I take a lot of medication every day. I take like 4 pills a day,
Right.
and that's just a blood pressure pill. I take a second blood pressure pill, which is basically a fluid pill.
Okay.
I have to take allergy medicine because I allergies, pollen, dust, anything. It had my eyes burning and
Right.
watering. Um, and I take omeprazole. So the omeprazole is what they call the purple pill, and that's for my acid reflux.
Okay.
So my doctor said you need to take and eat something in the morning with that. So I was like, I'm 41 now. I'm gonna eat breakfast in the morning with my medicine. I need to take my medicine. So this morning I just so happened having one of those fibro falls and thinking that I cut the eye off,
Oh my goodness. Oh,
left the eye on, and I was already in the process of going for that carpal tunnel surgery, and I end up dropping the pot. My wrist gave out, so I melted my entire sock off my foot,
ooh.
and my mom ended up taking me to the hospital, but they sent me home. They just they barely cleaned it. They just wrapped it, sent me home with a boot. And so pretty much after that, that happened on a Thursday. My daughter had prom on Saturday. So I went through the next couple of days with it just blistering up.
I was getting ready to
And
say they didn't do anything to it. That could have
no,
really got infected bad.
right. But because I deal with my hydradenitis and keeping wounds clean,
Yeah.
I just kept it clean, kept it dry. I didn't break the blister, and I made it through getting my daughter to prom. I drove
Yeah.
her to the prom and
Mother
picked
does.
her up, sent her off, super mom, you
Yeah.
know. I got her through that, and that following Sunday after the burn, that's when they sent me off to the city. They sent me to Richmond so that they could send me to the burn clinic. So they didn't send me to the burn clinic until like 4 days later.
You went 4 days.
And
That
4 days,
I'm glad that you
four
knew how to take care of
days,
yourself.
4 days with a second and third degree burn. And I made it happen though. I made it through it.
That's
But
what's up.
it was like a cup every time I had to do the wound change and the wound clean after the burn clinic, it would break me down so bad when it was time for me to clean it that I was just like, I don't know. They might have to admit me because I can't do this at home. Like I thought I thought I was strong enough to do this,
Yeah.
but I don't know if I'm strong enough. But I surprised even myself. I surprised
Continue.
myself
Well,
with being able to handle it. Bless you,
yeah,
baby.
with all that
Junior.
you go through, I mean, with all that you go through, you already exude strength, because that's a lot. And then, getting to the panic disorder that you deal with, I mean, that's not an easy thing. I mean, to go through
Yeah.
panic disorder.
Now, touching on panic disorder, um, I did not, I never had any problems with a panic attack until I want to say about 3 years ago was the first time I had one. And the first one I had, I was leaving North Carolina because where I live in North Carolina, it's like a 20-minute drive, and I'm in North Carolina. I'm in Virginia, 20 minutes, I'm in Carolina. We're like close to the line.
Okay.
And it's like I left North Carolina and I was on a back road, and I think I had been having some issues with a tooth.
Mhm.
And I was thinking, oh man, this tooth has been bothering me. And it had been bothering me for a while. And I'm in the area that I'm in at the time, my signal goes out on the phone. Like you have certain areas that your
Mhm.
phone just does not work.
Mhm.
And this particular night, it was just me and my son on my truck. And we're coming down this road. I get to the end of it. My phone is still out. It's not working right. I'm trying to send messages like at the stop sign and it's not working. So it's like I cut my phone off, cut it back on. My tooth starts bothering me. And I'm like, gosh, why is it this bad? So I go ahead and when I start the phone and I start driving, the feeling that I had at that moment, it was like they'll tell you with panic disorder, it was impending doom. It was just like in my mind, I'm like, something is wrong.
Yeah.
And all of a sudden, I started feeling that thud, like that doom in my chest. And so I grabbed the steering wheel and I'm like, something is wrong. Then I start to feel like I can't swallow. Then I start to feel like I can't breathe, like I'm not getting enough air. That's when I guess it's called desensitization, or you literally don't feel like anybody anymore. You feel like you're fading.
Oh
You
yeah.
feel like you're passed out, like you feel weak. It felt like my legs were vibrating, like a phone was in my pocket going off, but I can feel it in my legs, my hands, my fingers are shaking, and I'm trying to still drive. So at this point, I literally, my tooth was no longer hurting. It's
Right.
like in my mind, I said, did an abscess under my tooth or something rupture and it's going through my bloodstream?
Right.
Everything is starting to freak me out at that moment. I literally called police. I called the police because in our area, it's like I was like, just let me get to the nearest county and I'll just pull over at the gas station. I can't drive anymore.
Right.
Like I'm on the phone with the sheriff department telling them, look, it's something wrong with me. I don't know what it is. I've never felt like this and I'm scared. I have my son on the car with me. I'm trying to just get to the nearest gas station where it's lights and I have to pull over. I can't drive any further. And so the officer gets there, he's standing there with me, and he's like, well, just think about this. As long as you can talk, you're still getting air.
Yep.
And I was like, in my mind, he's telling me this, but I don't believe it.
Oh, I get
I
it. Been there,
don't
done
believe
that.
Like I do not believe that I'm getting the sufficient
Yep.
air that I need to breathe. Like it's not enough. I'm not getting enough. And The ambulance came. They checked my vitals. They said, your heart is good. Your breathing is good. Your oxygen is 100%. Everything is checking out fine.
Right.
The first thing they asked me, have you taken any drugs?
Yeah.
And I was like, now at the time, I used to smoke marijuana.
Right.
I literally stopped smoking marijuana 2 years ago because I was afraid that it was inducing the panic attacks.
Yeah. Yeah.
So it's like I got to the point where I was like, that's it. I mean, I was thinking that it was helping me, but I really, at that point, I was like, it must be hindering me
Been there,
because,
done that. Yeah. Been there,
yeah,
done that. Same
it's
thing.
it's, it's not worth it to me.
Yeah.
Forget it. Like
Yeah.
that's okay. You can keep your devil's lettuce. I'm fine. But it's like that first time that it happened,
Yeah.
that one really did it for me. And like I literally, my mom and dad came and picked up my son. They picked up my truck, and the ambulance took me to the hospital. My dad picked me up later, but when I got there, like I was not on any form of anxiety medicine or anything at that time.
Mm-hmm.
I've been on about 6 different ones since then.
Yeah.
And another problem that they have is because so many things are considered controlled substance now,
Yep.
is they will say, oh, well, we'll get you to take this and you take this every day. And that should help with the, panic attacks. Okay, but what about when the panic attack hits and you need something immediately, like immediate release? And that's
You're
the
right.
difference between a daily pill
You're
and
right.
immediate release.
You're so right
So,
about that.
I found that I've been on Xanax before. The Xanax would work instantly, 20 minutes, I was okay.
Mhm.
They took me off of that to put me on another one that was a daily pill because, of course, the Substance Control
Yeah.
Act.
Yeah.
Then I got to where another doctor recommended me to take Ativan, and it's the dosing that they give is like 0.5. It's a really low dose,
Mm-hmm.
but you would be surprised what that low dose will be the difference between you being on a level playing field and starting to skyrocket. And if you are able to catch it before, like I know the effects of a mild panic attack
Yeah.
coming on
Yep.
versus a like a tornado of one coming.
Yeah.
Um, I've had it where I know what they're telling me as far as dosing to take,
Mm-hmm.
and like I take that and I still feel that panic feeling and have had to go to the emergency room because, okay, it may be something that is wrong going on with
Yeah.
my heart. I'm scared.
I
And
get
I'll
it.
tell, like, I instantly now, if I like been to the emergency room in probably like, I mean, months,
Yeah.
and that's good for me. Like, I'm the last time I went was when I had the burn on my foot. I
Right.
try to stay away from there because too many times they look at you when you go into the emergency room as you're a pill seeker.
Yeah. You want pain,
And
and it's sad.
yeah, that's what they look for.
Yep.
They think that every time you come in that, oh, they just look for pain meds.
Yep. Yep. But
Baby, with what
panic
I go
disorder.
through,
Mm-hmm.
right, like what I'm going through, don't think that I don't already have something to take at home if I need to take something for pain. I'm here because I'm literally going through something and I don't know what it is.
I'm telling you, and
Now,
panic disorder is not a joke. Like people that
they
have gone
downplay it.
through it, they understand. But people that have never experienced a panic attack, it's easy for somebody on the outside to say, "Oh, just think about something different," or refocus. Your brain literally does not allow you, because if you think
No,
you don't want to think about something else, then you're mistaken. But your brain
right.
does not allow you to take it off of whatever that negative those negative feelings just take over.
And it's so weird because most of the time that I have gone into panic attack has been when I'm about to go and drive somewhere.
Mm-hmm.
I used to have a severe fear of long bridges
Mm-hmm.
and tunnels.
Okay.
I would try my best to stay away from anywhere that I had to go through a tunnel or I had to go across a bridge until I had to cross a bridge to go and visit somebody, or I had to go through the tunnels.
Right.
Like recently, my son, he's in the Talented and Gifted program, and
Hey,
he went to Washington, D.C. Yes, right, my
where I'm
professor.
from. Okay.
Big ups to my baby.
That's
But
right.
when I went up there, it was a lot of areas with tunnels.
Yeah.
And if I hadn't been able to, like, I've gotten over my fear of the bridges
Good.
slightly.
Right.
I'll
Right.
get through it if I have to. But the tunnels, I kind of got through that,
Good.
and it took time. It was more of a, like, the panic attacks that I have had more recently have been mild in comparison to when it first would happen.
Yeah.
But I still have that. I know when it's coming.
That's
I
the
can
key.
feel it before it hits.
That's the key.
And
You're
that's,
feeling.
yeah, it's like I can feel certain things. Like I can feel that flutter in my chest.
Absolutely.
I can feel the lack, like in my mind, the lack of oxygen I'm getting. Normally, the first thing I do is get something to drink.
Right.
I get some water and I try to drink some water and I have to walk.
Yep.
And it's like walking will start, I guess because my heart is already going so fast that I have to try to get my stride in
Yeah.
my walking to match up with it, to understand. Like I kind of talk myself down. I'm like, oh,
Yeah. Yeah.
you're having a panic attack. You
Yep.
are not about to die. You have to calm down,
Have to
just
do that.
breathe. And I think the last one I had, I was on my way home and I started to feel it in my legs and in my hands coming up. And it's like when I pulled in the yard, nobody was here. I thought my mom was at home, and I pulled into the yard and I'm looking and nobody's here. That was one of those times that I literally got, it's like I didn't step out of the car. It's like I just kind of rolled out of the car and put my hands on the ground and had to touch the ground. I had to feel the grass. I had to kind of balance myself because if I tried to stand up and you feel like you're going to pass out,
Yeah.
you literally will feel like you are not there, like
Oh,
you're slipping.
yep.
It feels literally like your soul is slipping out.
Yes.
And it's a guy on Facebook. Um, it's anxiety exercise, and I just ran across his page like the beginning of or the middle of last week, and I watched his videos, and it's like I never was able to really put into words to describe how I felt when I had my panic attacks. But this man, he literally, I mean, the exact feelings and what you feel, what you sense, he put it all into his videos. And I was just like, I'm watching this man in awe, like, wow, you really put it in, you broke it down for people to actually see and, have a visual for what is taking place when these happen. Because I mean, it seemed like every time though, when I'm about to drive, like I don't have a problem with driving. I don't like driving too close to transfer trucks, but
Yeah. Well, I don't either. But I think
you
that
know,
you knowing
nobody
that
does.
Yeah, and I think that may be a trigger for you. Once you get a step behind the wheel, there's something about that that
Right.
triggers a little something in you.
It's something about it that kind of sends me somewhere. And
Yeah,
I mean, not that I'm really paying attention to it, but it just instantly, like I can be driving along and then I'm like, okay, I don't feel right.
right.
I'll pull the car over.
Good
I
job.
pull the car over and I'm like, I'm sitting there and I can continue to feel that thud in my chest or the palpitations. And so I jump out of the car and then I'm marching, like walking around the car,
Yeah.
walking around
Yep.
the car. And then I'm like, okay, okay, I'm all right. I'm okay. Literally, I have gotten to the point like that. I think the one before the last time I'm outside of the auto shop, like they're closed but I'm outside of it and I'm calling, you know, everybody like, look, I'm not right, something's not right,
Right.
and I can't drive, you got to come up here, you got to come meet me. I'm ready to come, like ready to take my clothes off,
Right.
like something, like I feel like everything is constricting me. I feel like my shirt is binding me. I'm in the car taking off my shirt, sitting there with my head down, drinking water, just like I found out heat is a trigger.
Mm,
Heat is a trigger for me. I don't know how it is for other people, but heat can be a trigger for me. Getting in the car and having to drive, and it doesn't even have to be a long distance drive,
right.
be to town, but or just behind the wheel. Those are the worst for me because when you're driving and have a panic attack, you have to pull over. If
Oh
you're
yeah.
not close to your
Yeah.
destination, you have to pull
Yeah.
over.
And I think that's good advice to give somebody that may be going that may go through it while they're driving because that would be my suggestion as well is to pull over,
Right,
get your bearings together. And what you said about getting out and walking, I think that helps the pacing back and forth because even though
right.
it's still there, your mind is focused on the walking as well. It may
Yeah.
not be the panic disorder
It's
way, but it is a distraction.
yeah, and that's the main thing. It's like if you start, for anybody out there who is unsure of a certain feeling that they get every now and then, sometimes it's like over time you learn to work through them.
Yep.
And everybody does not have the pleasure of being able to be medicated for it. And
Yep.
there are a lot of people out there that suffer through these things and they don't have any other option
Yep.
but to push through them.
That's true.
And if you don't, and if you ever feel a feeling like you can't swallow, you can't breathe, heart palpitations, just scared, you don't know what's going on, you feel like, oh gosh, is something wrong with me? I feel dizzy, like vertigo.
Mm-hmm.
You chances are you are having a panic attack,
So true. So
anxiety
true.
attack, however they word it. You're suffering with something that is real.
It's so, so true.
You, it is a real thing.
And don't let nobody tell you otherwise because it is a real thing.
Exactly.
And
The
our time running out. I don't even want to have to lose you again. Tell me this. If if there was a if there was a study and you were asked to be part of this study that could cure you from the hydrodenitis and the fibromyalgia, would you be part of the study?
I would, if it would be a chance to help myself, but to help a majority, because it's so many people that suffer from it. Especially if not if it meant that it would be side effects that would make things worse.
Sure.
But if it was where it was mild side effects, so maybe headache, a little nausea, oh yeah, I'd be like, okay, what is it? What we
Right.
gonna do?
Exactly right. But you're
You
right about
know,
that. That is something to note because I mean those side effects, it could cure this, but then you'll have this. So
exactly.
yeah, I get it.
And back in my TikTok videos previously, they had started me on a medicine that's actually for cancer patients, and it had me feeling weak and nauseous.
Wow.
So I couldn't take it. It would put me down for 2 days. But
Oh, nah.
it's like I tried to get, they say Humira injections
Okay.
help every night. So anybody out there that is suffering from abscesses reoccurring in the same spot, definitely look into talking with your doctor about if it is possibly hydradenitis, especially if they're reoccurring. And they say that Humira is a good option. I mean, there are support groups out there for hydradenitis that I'm in, linked on Facebook and stuff like that.
Good.
There are support groups for fibromyalgia. And then you never know what family member may have suffered from it, that it's hereditary. It just affects on different levels, because abscesses run in my family, but the hydradenitis, it's maybe me and another cousin that suffer from that.
That's true.
So,
Okay. I didn't know
you
that.
know, it is genetic. It is genetic. It's something that's in the family, and it's like it's genetic but not contagious, you know?
Okay. Right. So what made you decide to take your story to Facebook? Like, what was that moment that you said, you know what? I'm going to share this with the world.
Well, at first, I looked at how whenever I mentioned what I was dealing with, how people would give me this strange look. What?
Mhm.
And I'm like, you don't know. So I would always tell people, Google it.
Mhm.
Just Google it.
Right.
Everything you need, 9 times out of 10 in this day and time, you will find on Google, and they're going to give you the information. Be like, don't be bothered for it. Look it up, you
That's
know?
true.
And a lot of people, it's the best way for them to understand it. And two, if you have a partner, it's better for you to just be open about the fact that I suffer with this.
Mm-hmm.
If you can't deal with this, then it's no need to waste time, because you got to be prepared for my down days. You got to be prepared for my up days.
So
You
true.
know, people suffer in silence a lot of the time. And that's what I did at first. I suffered in silence until I said, well, I'm not ashamed of what I got going on. It's just, this is me and this is a part of me. So all I can do is educate other people,
I love
you
it.
know.
I love
If you
it.
see me if I sit there and I say, this is not a good day, you can already imagine what it's going to be. It's either I'm in pain, or I must got a flare up and a spot is bothering me, and I don't feel like being bothered.
I get it. Right?
You know, 'cause a lot of people don't get it. You know, some people just be like, oh, she being funny. No, I ain't being funny. I'm being miserable,
I get it. Yep. And I don't
you
want to be
know,
bothered.
and I ain't bothering you about it, you know.
Yeah. No, I completely
You know,
understand. I get it.
something, yeah, it's tough. It's tough to deal with these things on a daily basis, and you never know when it's gonna pop up. That's the thing, you know.
Mm-hmm.
All of these things, you never know when it'll affect you. And that's the worst part about it. With hydradenitis, I don't know when a spot is going to come up. I don't know until I just so happen to turn a certain way or bend a certain way. And I'm like, ooh, what was that?
I
Okay.
totally get that.
Then I go and I get one of my mini mirrors, and I'm examining and I'm looking to make sure and check myself out, like, what's
Right.
going on? Same thing with the fibromyalgia or the panic disorder. You never know the onset. You never know when something is going to affect you a certain way.
That's so true. It's so true. And I mean, you don't know unless you deal with it. I'm just glad that you decided to actually come online and share your story and what you go through, because like you said, there are people out there suffering in silence, and you are being a voice for those people to let them know it's okay. I get it. I'm one that understands because you actually go through it. So I commend you for that. And I please don't stop. I will tell you that I'm a supporter of yours, and I'm watching you. So you are being heard. You know, what
Definitely.
tell everybody your social media information, where they can follow you, how can they get in contact with you? If they have questions, be willing to answer them.
Right. Mainly I'm on TikTok. I haven't really done much as far as my reels on Facebook when it comes to hydradenitis, but I'm April Red Hawthorne on Facebook. I think it's, see what it is on TikTok. Because I don't even think I paid attention to what my name is on TikTok. Okay, April Renee. Okay, Red Fox 82.
Okay.
Red Fox 82 on TikTok platform that I use when I talk about anything with the fibromyalgia or panic disorder, any of that. Normally I go to TikTok for that. I did change my Facebook to a digital creator, but I ain't really creating nothing on Facebook. That's just a bunch of pictures of me and our kids.
Well, y'all follow her on TikTok. That's where I found her, and I follow her. So
yeah, I'll be on TikTok, y'all.
Let's support each other. One last question before I let you go for the afternoon.
All right.
Will you promise to always spread peace and love in this world?
I most definitely will. I stand 10 toes down for it.
That's what's up. I appreciate it. And I appreciate you. And I want to thank you again for joining me. I really enjoyed speaking with you, and it was very, very informative. Just to let you know, I learned a lot. So I thank you for joining me.
All right. Y'all have a great day.
Thank you. You too.